Tonight, before you go to sleep, I want you to do one small thing. Reach down and touch both of your feet with your hands. Feel them carefully. Are they the same warmth, or is one of them colder than the other? Most people have never checked this in their entire lives. And most people have no idea that a difference this small, this quiet, this easy to ignore, can be one of the earliest warnings the human body ever gives. Because what feels like nothing more than cold feet, or tired legs at the end of the day, or a cramp that comes and goes, may be your body quietly telling you something about your heart. And it may be telling you years before your heart itself ever says a single word. I am Dr. Hiroshi Nakamura, and after more than 20 years working with older adults in internal medicine and geriatric health, I have learned something that still surprises the people who sit across from me. The legs are the furthest outpost from the heart. That distance, that long journey the blood must make down to your feet and back again, is exactly what makes the legs the first place circulation trouble appears. Long before the heart complains, long before the brain gives its warning, the legs are already whispering, quietly, patiently. Most people simply never learn how to listen. Tonight, I am going to teach you how. Here is what most people do not realize, and it is the single most important idea in everything I am about to tell you. When we notice cold feet, or a cramp in the calf, or a small wound that will not seem to close, we tell ourselves the same comfortable story. It is just age. It happens to everyone. There is nothing to be done. But the arteries in your body do not narrow only in the legs. They narrow as a system. The very same disease that stiffens and tightens the vessels carrying blood to your legs is, in most people, tightening the vessels that feed your heart and your brain at the very same time. The legs are simply where it becomes visible first. That is the entire secret. On the surface, it seems harmless. Inside the body, something very different is quietly unfolding. Before I show you the signs, I want you to understand the mechanism, because once you understand it, you will never look at your own legs the same way again. Think of your arteries as a system of pipes carrying fresh, oxygen-rich blood away from your heart to every corner of your body. When you are young, those pipes are wide, smooth, and flexible. Blood rushes through them freely. But over many years, a slow process can build up along the inner walls of those pipes. We call it plaque. It is a mixture of fat, calcium, and other material, and it narrows the channel that the blood flows through. This narrowing does not happen overnight. It happens over decades, so slowly and so silently that you feel nothing at all while it is happening. And here is the cruel part. Your body is very clever. It adapts. It finds ways to cope with a little less blood flow, so you never notice the loss, until, one day, you ask your legs to do something ordinary, like walk to the shop, and suddenly they cannot keep up. Let me now walk you through the signs, one by one, calmly, the way I would if you were sitting across from me in my quiet office with the door closed. The first sign is cramping or aching in the calves when you walk. That eases the moment you stop and rest. This is perhaps the most common and the most ignored of them all. Many people feel a tightness, a burning, or a deep ache in the calf muscle after walking a certain distance. Perhaps it is after one block. Perhaps it is after two. They stop. Often they pretend to look in a shop window, or they bend down as if to adjust a shoe, because they do not want anyone to see that they needed to rest. And after a minute or two, quietly, the pain fades away completely. So they carry on, and they think nothing of it. But this is not nothing. This is a very specific pattern, so specific that it has a medical name. We call it intermittent claudication. The word comes from an old Latin word meaning to limp. And what is truly happening is this. Your walking muscles, when they are working, demand a great deal of oxygen-rich blood, far more than when they are at rest. A healthy artery can deliver that surge of blood easily, but a narrowed artery cannot. The muscle cries out for more fuel, cannot get it, and produces pain as its complaint. Then, the moment you stop walking, the demand drops, the muscle quiets, and the pain disappears. This is exactly why it is so easily dismissed. It only speaks during effort, and it falls silent at rest. People say to themselves, if it were serious, surely it would hurt all the time. But that is not how a narrowed artery behaves. In its early stages, it only speaks during demand. I want you to pay attention to one detail here. The distance matters. If you find that you can walk to a certain lamppost, a certain corner, a certain tree before the ache begins, and it is always roughly the same distance, that consistency is meaningful. That repeatable pattern is one of the clearest fingerprints of this condition. The second sign is one foot that is colder than the other. Not both feet feeling cold on a winter morning, which is perfectly normal and happens to everyone. I mean one foot, consistently, noticeably colder than its partner. Very often it is a husband or a wife who notices it first, feeling one icy foot against their leg in the bed at night. This is not about the weather, and it is not about your socks. It is a local supply problem. One leg is simply receiving less warm blood than the other, because the artery feeding it has narrowed more on that side. Warmth in the body is carried by blood. Where the blood flow weakens, the warmth fades with it. Stay with me here, because this next part is one that almost everyone misses completely. The third sign is skin on the shins that becomes smooth, shiny, and loses its hair. Look at the front of your lower legs. In a healthy leg with good blood flow, there is usually a fine covering of hair, and the skin has a normal texture. But where blood delivery weakens over time, the hair follicles are among the first structures to be starved. They need a steady supply of nutrients to keep producing hair, and when that supply falls short, the hair simply stops growing. The skin, deprived of its full nourishment, becomes thin, tight, and glossy, as if it has been stretched and polished. Most people notice this and think nothing of it, or blame it on their socks, or on age. But the body is telling the truth. Hair stops growing where blood stops arriving well. The fourth sign, and one I want you to take very seriously, is a wound on the foot or toe that heals slowly, or does not heal at all. I cannot stress this one enough. Healing is not a passive process. When you get a small cut or scratch, your body rushes an entire repair crew to the site through your blood. White cells to fight infection, nutrients to rebuild tissue, oxygen to power the whole operation. All of it travels by blood. So when a small scratch on your foot is still there a month later, still open, still refusing to close, that is not bad luck. That is a sign that the delivery system to that part of your body is failing. The blood simply cannot bring enough of the repair crew to finish the job. In my experience, a wound that will not heal is one of the signs that most often finally brings a proud, stubborn patient through my door when nothing else could. The fifth sign is a change in the color of your feet, depending on their position. Try this. Lie down and raise your feet up into the air for a minute. In a leg with poor circulation, the foot will often turn pale, even white, because gravity is now working against the weak blood flow, and the blood struggles to climb up against it. Now let the foot hang down over the edge of the bed or chair. Often it will turn a deep, dusky, purplish red. This is gravity now pulling the blood down, and pooling it in a foot whose circulation is too weak to move it along properly. These color changes are the visible proof of blood flow that has become too feeble to overcome the simple pull of gravity. And the sixth sign is the loudest of them all. It is numbness, tingling, or a deep pain in the foot at night, a pain that often only eases when the person hangs their foot off the side of the bed. Think about why that would be. When you lie flat, you lose the help of gravity that was pulling blood down into your foot during the day. At night, the flow becomes so poor that the tissue actually begins to ache from lack of oxygen. Hanging the foot down uses gravity to force a little more blood into it, and the pain eases. By the time a person reaches this stage, the earlier, gentler whispers have all been missed, and the body is now speaking as plainly and as urgently as it knows how. If any of these signs sound familiar to you, or to someone you love, write the word yes in the comments below. It helps me understand who I am speaking to tonight, and it may help someone else who is reading feel a little less alone and a little more willing to take their own body seriously. Now let me tell you about a patient, because a story will stay with you longer than any list of signs. I will call him Kenji, 75 years old. He was a sturdy, stubborn man, the kind who had worked with his hands his whole life and never asked anyone for anything. And every single day of his adult life, he had walked to the market. It was his routine, his pride, his small daily ceremony. Over about 2 years, without ever quite admitting it to himself, his walks grew shorter. At first, he began stopping once along the way. He told himself he was simply pausing to enjoy the view, to catch the morning light on the hills. Then he began stopping twice. Then, quietly, without any real decision, he started choosing the closer shop instead of the far one he had always preferred. He never told his wife his legs were hurting. He never told his son. He never told a doctor. He simply made his life a little smaller, a little quieter, the way proud men so often do when their bodies begin to fail them. They do not complain, they adjust. What finally brought Kenji to me was not the walking at all. It was a small scratch on his toe, made by the stiff edge of a new pair of shoes, a scratch that, after 5 weeks, had still not healed. His wife, who had been quietly worried for some time, finally insisted he come and see me. When I examined him, I found significantly narrowed arteries in both of his legs. This explained everything: the shortened walks, the pausing at the same points every day, and the scratch that would not close. But I did not stop at his legs, because I know, as I have told you tonight, that these arteries narrow as a system. So I checked his heart as well, and there too I found narrowing. Silent narrowing, giving him no chest pain, no breathlessness, no symptom at all yet. His heart was on the same road his legs were already far down. But because we found it in time, we were able to treat it, quietly and carefully, before it ever became a heart attack. Kenji looked at me for a long moment when I explained all of this to him. And then he said something I have never forgotten. He said his legs had been warning him for 2 whole years. The scratch, he said, was just the final notice. Now, this is the part of our conversation where the tone changes, because I do not want you to feel afraid. I want you to feel capable. Because here is something remarkable, something that gives me great hope every time I explain it. The single most powerful treatment for these narrowed leg arteries is something you already know how to do. It is walking. I know how strange that sounds. Walking is the very thing that causes the pain. Why would I ask you to do more of it? Here is why. When you walk to the point of discomfort, then rest until it eases, then walk again, you are sending a powerful signal to your body. You are telling it that the muscles need more blood than the narrowed artery can supply. And your body, which is far cleverer than we give it credit for, responds. Over weeks and months, it begins to grow new small blood vessels that route around the narrowed section, like a village building new side roads around a blocked bridge. We call this collateral circulation. It is your body healing itself, given the right encouragement, even at 70, even at 80. This is done properly as walk, rest, and walk again, and always in partnership with your doctor. So let me give you your simple, practical guidance for tonight. First, do the 2-minute self-check at home. Feel both feet with your hands, and honestly compare their warmth. Look carefully at both shins, and notice the skin and the pattern of hair. Press firmly on a toenail until it turns white, then release it, and watch how quickly the pink color floods back. If it takes more than a couple of seconds to return, make a note of it. And above all, be honest with yourself about your walking distance. Are you stopping where you never used to stop? Then, there are 3 things that matter more than almost anything else. If you smoke, please understand this clearly. Smoking is the single greatest accelerator of this entire process. Nothing damages these vessels faster. If you have diabetes, keeping your blood sugar well controlled protects these very same arteries. And finally, take gentle, careful care of your feet. Never cut into a corn or a callus yourself. Never trim a nail down into a problem. At this age, a small wound on the foot deserves real respect because it may not heal the way it once did. Now, I must be very clear and very serious about one thing before we finish. If a leg ever suddenly becomes cold, pale, and painful all at once, that is not something to watch and wait on. That is a sign of an artery that may have become fully blocked, and it is a genuine emergency. Call for help immediately, and if you have diabetes, any wound on your foot, no matter how small it seems, should be seen by a doctor promptly, without watching and waiting. Everything I have shared tonight is meant to prepare you for a conversation with your own doctor. I cannot diagnose you through a screen, and neither can you diagnose yourself. Only proper testing, a simple measurement called the ankle brachial index, or an ultrasound of the vessels, can truly confirm what is happening inside you. But now, you know what to look for, you know what questions to bring, and that changes everything. I want to leave you with this. Your legs are not failing you. Please hear me on that. They are protecting you. Every single day, they are giving you a free preview of the health of your entire cardiovascular system, if only you take the time to read it. The same disease that whispers in the legs can stay completely silent in the heart, which is exactly why these quiet signs are such a gift. They give you time, they give you warning, they give you the chance to act, while acting still means something. Kenji walks to the market again now, and this time he walks to the far one. If this conversation helped you see your own body a little differently tonight, please subscribe to this channel and give this video a like so that I can continue sharing with you what I have learned from my patients over all these years. And tell me honestly in the comments, when was the last time you truly, carefully looked at your own feet?